In this video, we're going to be talking about chronic tension, which is a big deal when it comes to chronic pain. It turns out that chronic tension occurs in patterns, and these patterns follow what Thomas Myers identified as large fascial superhighways running through our bodies. Here are just a few of those. The interesting thing about this is that we also have these deep reflex patterns that we're born with. A withdrawal reflex, a Landau reflex, a cross extensor reflex, a startle reflex. These reflexes aren't like the typical, reflex that you're used to where someone taps your patellar tendon and your foot jumps up. These reflexes involve large patterns of movement with the body, almost identical to the fascial patterns that Thomas Myers identified. Dr. Shirley Sahrmann, a physical therapist researcher, also identified primary movement dysfunction patterns that also are almost identical to these fascial patterns and these reflexive patterns that we are born with. So we have a biomechanical or movement-based pattern of dysfunction, we have a fascial-based pattern of dysfunction, and we have a neurologically based pattern of dysfunction. And the combination of these three issues causes chronic tension from head to toe in certain pathways in the body that follow those same fascial patterns that I showed you just a little while ago. What happens is when we are not moving correctly, such as if we have poor walking patterns and so forth, muscles become activated excessively along these patterns. And then because this is a habit and we are habitually moving this way, those patterns then stop turning off again. They just stay turned on all the time because you are constantly going to the same pattern again and again and reactivating it. Well, your brain says, hey, why should I relax these muscles if you're just going to keep using them all the time? So it stays turned on. And essentially, that's how chronic tension is occurring. Now, another feeder of this tension can be psychological issues, which then activate our sympathetic nervous system. And up to 40% of fascia is invested with sympathetic nerve fibers. The sympathetic nervous system causes the release of a certain cytokine, which is like a hormone that circulates through the bloodstream, that targets certain types of fascia called myofibroblasts. Myofibroblasts are laid down in areas of mechanical strain in our body. And so when we are also emotionally stressed or anxious or have any kind of emotional trauma, those cytokines are seeking out the areas of our body that are most mechanically stressed anyway and cause more tension in that area because the myofibroblasts have up to 6 times the contractile capacity of normal fascia. It's important to understand that tension is a big deal in the body and there are many ways that it develops. Now I'm going to take a break here and ask you that if this information is helpful for you to please subscribe and like this video, but also most importantly, please share it with others who are suffering from chronic pain because this type of information can help them solve their chronic pain. Getting back to tension again, we now understand that these tension patterns are following these fascial lines. And you saw earlier that the fascial lines reach from the top of the head to the bottom of the foot. And they can occur along the back, along the side, along the front, all sorts of different ways in the body. Also, these tension patterns are created by how we're moving. They can also be created by our emotional state. And so these are two big drivers of tension in our body, dysfunctional movement patterns as well as emotional or psychological issues, which then become essentially lodged in our body along these fascial lines, causing us to be locked into these dysfunctional patterns. So it's this never-ending cycle. The techniques that I have found that help solve tension patterns are called somatics. Somatics is a technique to reduce reflexive contraction along these large patterns of tension in the body. Unfortunately, in this video, I can't take you through a somatics lesson because they can take 30 minutes to an hour and you would never stick around for something like that. How do I determine whether someone has tension clinically? When they're lying on my table, if I am trying to just move their arm while they are theoretically relaxed and I'm meeting with resistance, it's telling me that they have tension in their system and it is unconscious tension. And so if I fix the biomechanical issues that I believe are at the source of their pain, but their pain keeps returning or these biomechanical issues keep returning, well, usually that's an indication that tension is occurring that's re-energizing the body to be locked into these patterns that cause pain. And so then we would have to use this technique called somatics to release it. I've created 8 Somatics lessons, and they are part of my digital home programs, which you can find the link up here. If you're interested in learning more, please join my masterclass over here. It's free. I take you through a few tests to help you understand your back and sciatic pain. It really helps a lot of people understand the bigger picture of why they're having pain. Thanks for watching, and see you soon.